Heat stroke is a medical emergency. You need to be seen at the hospital immediately if there's any concerns about a heat stroke. I think if you have concern at all, whether it's a heat exhaustion or heat stroke, you should see your doctor anyways. So as the seasons change and we're heading to summer, families have more time off, kids are out of school, so we see a lot more sun and heat related injuries and orthopedic injuries and outdoor activities. So for example, like heat strokes, heat exhaustion, dehydration, sunburns, insect bites, like diarrhea, foodborne illnesses. People are eating more picnics and barbecues, things like that. And as the summer happens, kids are out of school, so they're really pushing their parents' limits and things like that. They're traveling more, and so we see a lot more orthopedic injuries and things like that happen too at times. So heat exhaustion is a precursor to heat stroke. So if heat exhaustion is not managed and not dealt with, it can lead to a heat stroke. So heat exhaustion, the precursor, usually happens when patients are dehydrated, outdoor. They can have like dizziness, weakness, nausea, vomiting, just overall not feeling well, and excessive sweating. If these signs are ignored and we let that go on, it can, not always, but it can lead to heat stroke. And so this is more advanced than heat exhaustion. And in heat stroke, what we see is very high body temperatures. Patients are confused, they're weak, and mimic like stroke-like symptoms, or they can't walk or talk and things like that, or not aware or self-conscious. And a lot of times they are not sweating. So like usually that's a big distinction between heat exhaustion to heat stroke. Is heat exhaustion, they'll have excessive sweating, but heat stroke, the more serious one, they might not be sweating. And so sometimes patients think they're doing better, but they're really not. Heat stroke is a medical emergency. You need to be seen at the hospital immediately if there's any concerns about a heat stroke. I think if you have concern at all, whether it's a heat exhaustion or heat stroke, you should see your doctor anyways. As you become more active in the summer and going outdoors, I would say wearing long sleeves, wearing long pants, wearing long socks, avoiding areas with standing water, using insect repellent with DEET, I think will also help as well. Also, when you return from hiking and camping, things like that, it's good to do a skin exam on yourself, especially in areas that bugs and ticks can hide in, like behind the knees and on the scalp, are common areas that we find ticks. If you do have any concerns at all, you should ask your doctor to see if you need any kind of treatment for that. This is a very common thing we see in the summer, sunburns. So yes and no. So if you're very concerned, if there's a large area of sunburn, if it's very painful, if it's blistering or just not doing well and not healing, then yeah, I definitely say see a doctor and see if you need any antibiotics or additional therapy for your sunburn. But in general, somebody who has a routine sunburn, I would say doing like aloe or like cold compress to the area and drinking plenty of water. Staying hydrated is key, but definitely monitor your symptoms for any worsening or not healing, and then let your doctor know if it's not going as planned. Number one would be staying hydrated. So take a bottle of water or know where your nearest water source is when you're being outdoors and doing outdoor activities this summer. That's very important. Number two would be protecting your skin. So wearing long sleeves, long pants, and wearing sunscreen while you're outdoors. And number three would be knowing your limitations. Summer gets very hot out here, and so definitely check the weather and see what you're doing and know your limitations. So if you're getting tired and exhausted, that's probably a time to stop and go for another day. Don't push yourself this summer, and stay healthy and stay safe.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.